I want to talk about the common medications that we use, especially in our setting. So in our setting, the most common is a group called calcium channel blockers. So calcium is important for contracting of the heart and contracting of the blood vessels. So what calcium channel blockers do is that they prevent calcium from going into the cell, meaning they're preventing contraction of the blood vessels and of the heart. Because when your blood vessels are smaller, meaning there's more pressure, it's just like having, when you have a small hose pipe, a smaller hose pipe will give you higher pressure than a bigger hose pipe. So when the diameter is big, water flows out slowly. But when it's small, you have a higher pressure. So the calcium channel blockers will help dilate the blood vessels, hence reducing the pressure exerted on the walls of the blood vessel. So the most common in our setting is nifedipine. Yes, nifedipine and amlodipine. So those are calcium channel blockers, and that's how they work. The other common ones that we use are called beta blockers. So beta blockers will lower your heart rate. By that, they're also lowering your blood pressure. So common beta blockers are things like labetalol, atenolol, propranolol, carvedilol. Yes. Then the other group that I want to talk about is what we call ACE inhibitors, which is angiotensin converting enzyme inhibitors, which prevent this enzyme from forming this angiotensin. So angiotensin will have an effect on the blood vessels of the body, and it causes narrowing. So by preventing the formation of angiotensin, you're preventing the narrowing of blood vessels. So the common one that we use is enalapril. Then we have diuretics. So diuretics are used to, they increase the excretion of water and sodium by the kidneys. So by doing that, you're also reducing the blood pressure. And the common ones are furosemide or Lasix, as people call them. Then you have thiazides like hydrochlorothiazide. Yes. Then the other group that I would like to talk about is angiotensin receptor inhibitors. Yeah, angiotensin 2 receptor inhibitors. So these ones are also preventing the effect of angiotensin on the blood vessels. So angiotensin causes narrowing. If you don't have angiotensin acting on the blood vessel, you won't have the narrowing. So the common one in this group is what's it called again? Telmisartan. So those people who are taking Telma H. So Telma H is a combination of telmisartan and hydrochlorothiazide. So you're taking a combination of a diuretic and an angiotensin 2 receptor blocker. Yeah. I think those are the main ones. Yeah. So those are the main groups. So some people just take diuretics, and I know some people take what is called modiuretic, which is also another combination. So these are the common drugs in our setting, and depending on how you respond, we usually give them in combination. But Africans, we tend to respond well to calcium channel blockers like nifedipine and amlodipine. So we usually start with those, and we add something on like enalapril and other things like beta blockers and come in.